Hello, 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 hello. You are welcome again to Sex in the City. Hooray! I am your host, as always, Otin Kweku, and I'm here with Dr. Susie, who is going to take us through an interesting time today. Today, we are going to deal with a topic. We are going to continue with the HIV topic that we started last week. So, if you have not watched last week's broadcast, please go and watch it. It's available on Facebook, it's available on YouTube, and it's available on all our channels. Do that, go and watch it and enjoy yourself with it. It's actually packed with a lot of information. We have a lot of information over there, and so you can actually go and watch it and learn more about HIV. You know, I never knew that there is a difference between HIV and AIDS, whereas they are still the same. I never knew that there are stages in the progression. And also, I never knew that you can even test yourself at home. And that is what we are going to talk about today. We are going to talk about self-testing today. We are going to show you how to test for HIV, how to test your own self at home. If you are not sure whether you have AIDS or not, or maybe Charlie, I could try and some boys multi as there's a way you can actually test yourself safely. You can test yourself safely. So there are testing kits you are going to use, and today our dear doctor is here to take us through the processes, the protocols as is relate to Ghana. So we are going to deal with Ghana's protocol. Take note of that. Okay, so I'm going to bring on our doctor and she's going to take the show. Okay, so Dr. Susie, you are welcome. What's up?
Thank you. I'm doing very well. I'm doing very, very, very well. How are you too?
I'm also doing very, 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 very well.
All right.
So last week we talked about HIV/AIDS.
Yes.
Very, very interesting. You gave me some statistics about how people are getting infected in Ghana.
Yes. So earlier this year, Ghana AIDS Commission came out with the data that at least 50 people are getting infected with HIV every day. 50 new infections every day. And then we're making some of the statistics that if 50 every day, even that is people who have been captured. Okay, what about those who are working without knowing their status? So if you multiply that in a month, look at the number of people that are going to be infected with HIV. So we handle the importance of early testing, and then knowing your status as early as possible, and then taking the necessary actions to start your treatment. So that was what we did last week, and then we delved more into the HIV, the various symptoms, the signs that you can see. It was very, very interesting, and I'm sure a lot of people learned a lot from it. We also handled some of the myths and misconceptions regarding HIV, and it was an interesting session. So, like you said, today we are going to have a practical, hands-on, practical demonstration of the various HIV testings that you can have, both in the hospital setting and then an outreach. Okay, then we are going to narrow it on the self HIV test that you can do in the comfort of your home. A few years back, they were piloting self-testing, and then I think about some years ago, about 1 or 2, people can have the test kit and can do that in the comfort of their home. So I'll be taking you through. To start with,
okay, Dr. Susie, before we go on to the testing, I have a few questions that I did not come up with. I discovered that there are multiple types of HIV.
Yes.
Wow. Can you elaborate a little on it?
All right. So we have the HIV type 1 and HIV type 2. Okay. The HIV type 1 and type 2 are just strains of HIV, of which all our test kits that we are going to demonstrate today have the about with the various mode of transmission of HIV. So when it comes to the type 1 and type 2, the modes of transmission is all the same as we handled last week. The only difference is that the type 1 is more common, especially among the sub-Saharan, is more common, and then it progresses very fast. When you get a type 1, the progression is very rapid, but the type 2 is not common, and then the progression is also slow. So that is the major difference. But when it comes to the mode of transmission, the after effect and everything, they are all the same. In fact, honestly, in my practice, because the type 1 is very common, I have never seen a patient that is only stand-alone type 2 HIV. All of them is either type 1 or type 1 and 2. I have handled a lot of cases that have both the types, type 1 and then type 2. Okay, so
okay, so
yes.
listeners, very soon we'll be showing you the test kits, and you can then ask your question. You can ask your questions, and then you can interact with us.
Yeah.
This is actually interactive, so I'll be bringing the test kits on it right now, and then Dr. Susie is going to show us what they are. Okay, so doctor, I have here these test kits. Can you take us through them?
All right. Okay, so the first one I'm going to talk about is the mauve one that you can see. We call it the HIV first response test kits. You can see it, the first response test kits. Okay, this first response test kits, I'm going to talk into details with you. Let me introduce you to them one by one. This one is an oral quick for HIV 1 and 2. This is also another test kit that we call the rapid diagnostic testing, which is the Abbott. And then we have the oral quick, which is also for the HIV self-test. Now, this first three that I have introduced to you are used primarily at the hospital setting or an outreach setting, whereby in a hospital setting you can walk into any of them, either an HIV unit of the hospital, or there are a lot of places at the hospital that testing is done. Okay, you can have this test done after counseling, or maybe medical personnel from a particular hospital or an institution comes to your home, comes to your community, comes to your church, comes to your school, which encompasses what you call an outreach. Then this test can also be done for you. So with the testing protocols, when it comes to the hospital setting, or before an HIV status, or before we can tell you that you are HIV positive, it means that you have gone through all these laid down protocols. So like I said, the first test kit here is called the HIV, the rapid response. It can test for HIV 1 and 2, and then it uses your blood. So this particular mauve one, your blood sample will be taken. Okay, we'll clean you, and then we'll take a blood sample, and then we'll use it on this test. Now, let me take you through the principles behind all this tests. Okay, last week we learned that when you have HIV, when you have the infection, which is the human immunodeficiency virus, through any of the portal of entry or mode of transmission that we discussed, your body sees it as a foreign agent. They see the infection as a foreign agent. So what your body does is that it mounts immune response. Your body, we said, has a lot of soldiers that the Lord has put in our body to help fight infections. So when you have the HIV virus enter your system, because it is a foreign thing known to your body, these soldiers will be activated to work. And in the process, these soldiers produces certain proteins or certain things that we call antibodies. And as these antibodies are being produced as a result of the fight, okay, that is going on between your soldiers and the HIV infection, these antibodies are produced in your body so much that it can be detected. So that is a principle behind this test kits, okay? Sometimes the reason why when you come to a hospital and you said you have been exposed to unprotected sex, or you just finished something, a gala, like my hosts have said, and then you want to test, we will normally ask you, what is a window period? The reason why the window period is very important is that these antibodies take time to produce, and the more the infection and the interaction between your immune system and the infection is going on, the longer the time, the more the antibodies reproduce, and the more it will be sensitive. So when you come at very early stage of your exposure to the HIV virus, we may test you and you may be negative. You may be negative, and that is a false negative. Meanwhile, you may have been infected with the virus, but because enough antibodies have not been produced, we will not be able to get that particular antibodies for the test to pick up. All right. So we give you a window period. So sometimes you realize that when you come, we said, depending on your risk that you've been exposed, we said after testing, text again in about 6 weeks to 3 months time. Normally we do tell you by that time, the principle is that by that time enough antibodies would have been produced for you to be picked up on our test. So basically that is the principle behind the test of the HIV antibody test that we are going to explore today. So I'm going to open this for you to see. Okay? When you come to the hospital setting, all right, this test is very, very, very important, okay? And like I said earlier on, it uses your blood, okay? It uses your blood to work on it, okay? We have a place that you open it from, and this is for your healthcare provider to do, okay? Very easy to open, okay? Now, when you open it, there are two things. So this is what your counselor, you see, you can see it. You see it? If you can see it, we did HIV 1 and 2, okay? HIV 1 and 2. I'll put it here so that you will look at it later on. So this one is just a blood sample. It has its own solution that we call a buffer. So they will take the blood sample and they'll put it here, and then they'll add the solution which we call a buffer, and then we'll wait and you read the test, and that is all. Now, when we do this test for you at the hospital setting or outreach, and then you have a line, okay? There is the C. As you can see, we have a C, and we have a 2, and we have a 1, okay? The C means that control. It means that before you can read this test result, or before your care provider can read this test result, it means that the C, there is a line on the C, okay? Automatically, there must be a line on the C before you can proceed and read this result. So when you see the line on the C and you see another line on the 1, then it means that you are reactive to HIV type 1. If you see a line on the C and you see a line only on the 2, then it means that you are reactive to HIV type 2. If you see a line on the C and you see a line on 1 and 2, which means 3 lines in continuum, then you are reactive to HIV type 1 and type 2. Now, like I said, we have protocols. So when we do this test for you in the hospital setting, or an outreach setting, okay, because normally in outreaches, this is the only one that we take along. When we do this for you and it is reactive, because HIV infection is a lifelong disease, you are going to live with it for the rest of your life. We don't have a cure yet, so we want to do the due diligence. We want to be sure that indeed you are HIV positive, okay? And then before you start and we start you on treatment, we want to be sure of your status, because it will be very devastating for us to. Okay, so we are sorry for that short commercial break, and we want to make sure that we everything is visible for you to see. Okay, so like I was saying earlier on, this is the first test that we do for you, either in a hospital setting or in an outreach setting. And like I said earlier on, we don't want to be quick to tell you you're HIV positive. We want to do all the due diligence. So in Ghana, the protocol remains that when we do this test for you, whether in an outreach setting, we'll let you know that it is reactive of HIV. If it is negative, it's negative. If it is reactive, like I have explained, that you have a line on the control, which is the C, and then a line also showing on the one, or either the two or both, then we say you are HIV reactive. We don't say you are HIV positive. You are HIV reactive, okay? Then we will now move on to do the second confirmation. Now, this is the second confirmation. This second confirmation, we call it the oral quick. And this oral quick uses saliva from your mucous membrane, that is primarily your gum in your mouth, okay? So let me show you how the oral quick also looks like. The oral quick has two compartments. We have the stick, and then we have the part that is the solution. That is the solution. Okay? All right. In this one, what happened is that you have the stick here and the solution. The care provider will use it to wrap your gum, okay, and your down, and then you open up this solution, dip it into it, and then we'll read your result for you. Now, when we do this particular test, okay, you can see this particular one has only the control and the which is the C and the T. So the control will show that it is there is a line on it. I said earlier on that no healthcare provider will read a test kit that there is no line on the control. The line on the C is the basis for you to start reading your test result. So first you have your line on your C, and if it is still reactive, you still have a line on your T, which means that the second test is still reactive to your HIV. Then we have the last test that we do, which is the Abbott. So this one also uses your blood like the first one we used. And this is the last test that we do for you to declare that yes, indeed, you are HIV positive. So when this one also is reactive, like how the other ones shows the line on the test, then we can say that confidently you are HIV positive, so we are going to start you on treatment. But remember, there is a caveat. Okay, what you must know is that it is not all the time that all these tests will be available, especially when it is an outreach. So when they do the first one for you and they said it's reactive, please, when they refer you to go to a facility to get yourself done for the rest of the confirmation, please go. And also what happens is that for our pregnant women, because sometimes this test kits may not be available, especially in the hinterlands and the rest, when we do the first one and they are reactive, because of the risks to the baby, we start them on treatment before we do the confirmation later on to finally declare that they are positive. Now, that is what happens in the hospital with your care provider or in an outreach. let's come to the meat of the presentation today, which is the self-testing in the home. I said earlier on that Ghana, we have advanced because of stigma, and I'm sure a lot of things people don't want to come. They just want to widen the coverage of people coming to know their status early enough. So they have developed this nice package for you, and it is called the Oral Quick HIV Self-Test, that you can have this test kit at the comfort of your home, okay? Just as I'm sitting here, I can have this test van and get my results within 20 minutes. So this is what I'm going to take you through. You can have this in the pharmacies, the pharmacy around that are selling this. You can contact SHAP Clinic. We will be able to provide you with this test kit and then offer you online counseling on how to use it, and then we will be on the standby waiting for your results if you need to speak to a counselor. All right, so welcome back from that short commercial break. Then, like I said earlier on, we have the Oral Quick HIV Self Test. So this test kit is a whole package that you will use in the comfort of your home. So I'm going to start unboxing it, but before then, anytime you go for a test kit, the first thing you have to do is to watch out for the expiry date. So this one, the expiry date is the 31st of July 2025. It is very important. Look for the expiry date, okay? All right. Then the next thing you want to do is to wash your hands. Come and sit down comfortably. As you can see, we have two edges open here. This is where you would tear your package from to open it, okay? This is again the self-test kit for HIV that you can do in the comfort of your home, your office, anywhere privately. So you have to tear here. You can see I'm tearing the package. So religiously. Okay. All right. Good. I have teared it. Finally. So now this package contains 3 things. Okay. One, it has what we call the test kit stand. Okay, this is the stand. Okay. So I'm going to put the stand down. Then we have what we call a manual. This manual has both English and Twi versions, okay? So if you cannot read or identify letters in English, at least we have the Twi versions of the manual. And this manual gives you a vivid description of what to use. All right. So I'll just show you how the manual is. This is the Twi version. Let me show you how it looks like. Even if you cannot read or write English, the manual is very simple. It has pictorial or pictures, okay, telling you at each stage what you should do. All right, so you will not be missing at all. You won't be missing at all. All right, so now having my manual down, I have opened my kit. One thing that you need to be sure of is that this test kit is time bound. 20 minutes, not less than 20 minutes. So before you start unboxing your test kit, one thing you have to do is that get your timer down. You can either use a stopwatch, you can use your phone, and then put a timer on your phone, and when you start, then you can now press it and then you read it after 20 minutes. All right, so you can see that this unboxing in the test kit, we have 2 compartments. Okay, we have 2 compartments. The first compartment is the test kit solution. Okay, all right, or the test tube. You can see it. It has a liquid inside. All right, this is it. It has a liquid inside. Please, this liquid, when you open it, do not drink it. It is not to be drunk. It is not to be poured out. Okay, so what you do is that when you have it, you see there is an opening here. There's a cork on it. Okay, so you open this cork and then you put it on your stand. Can you see it? It is sitting beautifully on my stand. Okay, all right, and then you just open it like this. Ta-da! We are done. Have you seen it? Yes. So you open it and then you expose the fluid in it, and then you put this your stand on your table beautifully. Then you open the next of your pouch, okay, which has the stick or the test kit. You can see it. Okay, the other one that I showed you, I showed it to you. I told you that we have the C, which is the control, and we have the T, which is the test. So the control means that is what is going to guide you to read. So you have a line on the control. If you have a line on the control and there's no line on the C, then it means that you have a negative result. If you have a line on the control and then there is a line on the T, meaning making it two lines, then you are reactive to HIV. So you have to come to the hospital and then you get to know whether it is really positive for HIV and then which type of HIV to get. The self-test kit at home does not give you the exact type of HIV that you have. So now, having your liquid, okay, or reagent on your stand, this is how you do your test kit at home. I'm going to demonstrate myself, and then today I'm going to know my HIV status right here and now, but I will not show it to you. I will not show you the result. Do you know why? Because HIV results are confidential. All right? Okay. So this is how you demonstrate it. I told you that it uses saliva from your mucous membrane in the mouth. You need to do this very well so that you'll be able to get accurate results. So this is how you do. You take, you realize that the ending of it looks like as if it's a toothbrush or a toothpick or something like that. We call it more like a spatula or something. So that is the part that you use to rub your gum. Okay, so you go like this. All right, then you turn the other part beneath, and that will pick up your saliva. All right, have you seen how I did it? You go one round and then you come down and then you go again. So that is what you do to take your sample adequately. All right, enough saliva. Then after doing that, you have to dip this inside the solution. Inside the solution. When you dip it inside the solution, you will now click on your timer and wait for 20 minutes to read your result. 20 minutes to read your result. How simple and that is. Very, very, very simple. Very, very, very simple.
Whoa.
Very, very simple.
Dr. Susie, we thank you so much for this demo.
Yes.
And teaching us how the protocol for testing HIV in Ghana is.
Yes.
So I've learned that there are 3 basic test kits in the protocol.
Yes.
The move one, another one, and another one. I'm forgetting again, guys. Okay. So basically, it's 3, and then it moves from one stage to the other
Yes.
And also, I've learned about the self-test kits, which I can use in my home, in my own privacy, to check myself.
Yes.
So, how many times do we check ourselves? How many times should we check ourselves? For example, I check myself today, and it is negative.
All right.
Does it mean I'm negative forever?
Okay, so let me talk about what to do after you have done your test.
Okay.
Then can you give me one of this?
Okay.
So let me talk about what you can do after you have done your test, okay? And then we'll talk about how often you will do your test. So now, after 20 minutes, you will read your results, okay? I said earlier on that after 20 minutes, your result is ready. You check and see, do you have a line on the C? If there is a line on the C, then your result is good to be read. Then again, you will look at the T. Do I have any line? If you have a line on the C and there is no line on the T, it means that you are negative. But if you have a line on the C and you have a line on the T, it means that you are reactive. Irrespective of how faint the line is, you are still reactive, okay? But when you do your test and you realize that there is no line on the C, there is no line on the T, it means that your test kit or the result is invalid, okay? You cannot read it, okay? And then if you have a line on the T, there's no line on the C too, it means that the result is invalid, of which you cannot read it. So those are the interpretations, okay? Now, what do you do? What do you do? Back to the question. HIV testing, if you are negative, you are to retest yourself in the next 3 months, okay? That's so maybe you took it because there was a risky encounter and you think that you are at risk of HIV. So after that 6 to 3 months, you can repeat your test. But other than that, ideally every 6 months you should check your HIV status. All right. So if you are non-reactive, that is what you do. You retest yourself in 6 to 3 months, depending on the risks that you were exposed to or what made you to rush to get the test kit. Now, if you are reactive, please do not panic. Just be calm. Take a bold step to the nearest clinic or hospital near you, or call us, SHAP. We are always there for you. Get in touch with us. We will be able to have one-on-one counseling with you and then take you through the other tests that I have outlined. I told you that this one does not tell you which type of HIV you have, and you cannot declare yourself positive based on this. So when you do it and you have a reactive result based on the interpretations I have given earlier, you have to seek a counselor so that further tests will be done to finally confirm that indeed you are HIV positive. Then we can start the treatment protocols that are available for you.
Okay, great. So guys, we have been lucky to have Dr. Susie to take us through this wonderful testing process.
Yes.
Our number is on the screen. You can contact Dr. Susie and she would help you with the counseling and with everything. And if you need supply of these test kits,
yes,
you can always reach out to SHAP Clinic,
yes,
and we'll make it available to you. We'll have it delivered to you in your home, packaged nicely, yes, and you will be safe. No one will know anything. So guys, thank you very much. This has been Sex in the City, and this is the end of our broadcast. Bye-bye.
Bye.